Hey everybody, I wanted to share with you what it was like for me to transfer from managing my practice on pen and paper files to using a practice management program. I made that switch several years ago. And the reason why is because I couldn't stand doing all the paper record keeping. My handwriting is atrocious. I don't like handwriting. And also, it was really hard for me to keep organized. I don't know what about you, but I still have all these paper charts from years ago, right? And in each client file, there's two sides, and I had to keep everything organized. I had to keep their record keeping of their accounting, of their when they paid, their invoices, the progress notes, any documentation that I had for them, like letters that I wrote for them, assessments that I did for them, all of that stuff, correspondences, all that documentation had to be kept in that paper file. Hopefully when I put it back in the right spot. Because when someone wanted a piece of information, I had to go to the file, hope that it was there, hope I could find it, right, and then get it to them. And everything in my practice was seemed like it was fragmented, right? I did scheduling on a program, I did billing on a program, I did my record keeping somewhere else. I had to send them files and attachments in another secure way. I had to do insurance billing separate. Everything was separate. Communicating with clients was done one way. Communicating with my biller and admin was done another way. Oh my goodness. So to be HIPAA compliant, I had to do a risk analysis of all those different procedures, which was a real headache, right? So I wanted things to be easy, organized, easy to find, easy to document, all in one place where I could access from anywhere. So that's why I transitioned and using a practice management program. And when I selected a practice management program way back when, there wasn't a whole lot of programs available. But the one that I chose was really good, and I continue to use it because it's really good. The one that I use in my private practice and have been using for years is Counsol, as you can see on the screen here. And it was really neat because once I made that transition, by the way, the transition was super easy. All I did is sign up, and my new clients, all I did is start having them register on the new platform. All their registration forms were electronically signed, all done right there, all payment, scheduling, communication, everything. So it was easy. All the new clients just simply registered on the new platform. So that's what the transition was like. And let me mention, I recommended this program to a colleague of mine, and this colleague has a lot of clients. And she's one of those clinicians who's able to see 10, 11 clients a day somehow. And her transitioning those clients into using Counsol is actually really easy for her too. It was just setting up an account for them, and she was even able to just scan the documents, put them on their file. So that was really cool. So now that I use a practice management program, I actually enjoy the business side of things because it's so easy, right? I'm like, oh, it's so easy and convenient. Whereas before, I was really getting sick and tired of it. I couldn't stand it. I love counseling, but I couldn't stand all the administrative tasks. So like with Counsol, as I'll show you here, I could manage my clients. I could go to my client's file. So these are the clients. This isn't a real, this is a demo account. And I could look at their past sessions. I could chart on their sessions very easily. I just click on create a new progress note. I choose the session I want to document on. All the forms are already there for me on the program. Secure messaging. If I want to communicate with my client, I do it through this mail button. It's like email, but it's secure. Isn't that cool? I can do video conferencing with them and chat with them. All my accounting is right here on the system. What was paid, what wasn't paid, all my invoice information. I'm able to create my appointments, cancel my appointments. Clients, if I allowed them to, they could schedule themselves and cancel their appointments. I could put all my clinical forms on here. I could assign clinical forms to clients, and they're able to electronically sign off on them as they need them. I'm able to do electronic billing to insurance companies automatically when I schedule the appointment. It's really neat. My admin assistant and my biller, they're on here as users. So you can create user accounts with certain capabilities according to what they need to do for you. So there's so many practice management programs out there. They're in terms of how easy they are to use, varies from one to the other. One thing that sometimes is a little bit challenging is to determine which practice management program is a fit for you. So that's one service I provide. Is if you need help with that, I'd be glad to help you with that. You could also purchase a document that I created where it's like a worksheet that helps you make an informed decision about what practice management programs are really going to be useful for you. I also do consultations where I help people get set up on practice management programs. And another thing that I just began to offer is I want people to be able to get a discount on using a practice management program. So I joined an affiliate, I now have an affiliate agreement with Counsol, where I do get a kickback for those that sign up with Counsol through me. But I only show programs such as Counsol if I truly believe they're really good and I really like Counsol. That's why I use it. And anyone that signs up through me gets $5 off per month on their fee. And there's a coupon code for that. It's telehealth, right? And I'll have that in the details section of this video and also on my blog. If you want to know anything else about the transition from files, right, to using a practice management program, what it was like for me, advice for you, just simply give me a call or email me. I'd be glad to talk to you about that. And thanks for watching this video, and hope to talk to you soon. Bye-bye.